is nowadays becoming very common. Although many anomalies or birth defects are becoming less, the incidence of hypospadias is continuing to be high. And in this video, I want to tell the parents about the various questions and answers which they have. Also, I normally give them a lot of instructions before and after surgery, so I want to highlight on all those points. Now, many parents ask me why this happened. What's the reason for hypospadias? Is it something they ate or something they drank or they could have avoided? There is no clear-cut answer for that because we really don't know why this happens. There are multiple factors involved in this, so it is not just one factor, but maybe chemicals which are contaminating the water, the vegetables, the chicken and other things. So many things may be there. So we cannot ascribe it to single agent like water contamination or vegetarian or non-vegetarian food. I mean, we have to eat, so we cannot stop hypospadias or chemical contamination. So what I would suggest is focus on the way forward. Don't go looking backwards. Whatever has happened, we have treatments available. We have methods to correct it, and then it can be fully corrected. So that is the one good news which you all have to remember. So you should look forward to what actually happens next. So other question which they ask is what is the right age to operate, or what, do they need operation? So I start telling them about the various types of hypospadias. If it is very much almost at the tip, then they don't have to have operation. But if it is a little bit down, then they may need a single operation. If it is further down, then they may need two operations to correct it. Either way, the parents have to be aware of all these facts. Also, the timing of surgery, many of them ask like what is the best time to operate. Around 1 year of age is the right time to operate, because after that it becomes very difficult to manage them, and if they need a second operation, they can complete it by 2.5 years before they go to school. So that way it is very helpful for them to complete the 2 stages also, and then stand and pass urine like the other boys when they go to school. So the ideal age for surgery is around 1 year for the first stage, and then maybe 2 years for the second stage. Now, a lot of instructions I give for the parents. I give them as a leaflet and then printed material. So I would like to tell one by one to all of you. So one of the main thing I tell the parents is before the hypospadias operation is done, they should ensure that the baby has the habit of sleeping flat, because many babies have the habit of going on to their stomach and then lying upside down. And if they start this practice of sleeping, then after surgery it becomes extremely difficult because tubes and dressings are there. And if they turn upside down and then sleep on their tummy and then damage the tubes and dressings, they can actually break the suture lines. So this is one of the things which I ask to tell the parents right from the time of birth, so that when they come to 1 year of age, they are able to comfortably sleep flat on their back. Now, other important thing, particularly in the Indian setup, is to give the healthy food. So either they should have a breast milk or a formula feed, and also they may have to give iron and vitamin supplements from the age of 6 months onwards, so that by the age of 1 year, they may have to get the child fully nourished. Sometimes 3 doses of hormone injections are given between 9 to 12 months of age to increase the size of that organ. So often the surgery is planned after the first birthday. So for this assessment, the child has to come at the age of like 8 to 9 months, so that we need to see whether the hormone injection is needed or not. Now, at the time of surgery, we have to ensure that the baby does not have a cough or cold. Otherwise, anesthetic witness will not be obtained. And often the doctor plans a single stage surgery, but 2 stages may be required in severe cases, and it will be planned after a gap of 6 to 9 months. Rarely, even after planned single stage surgery, a leak can happen. So this we have to be aware of, and then the parents have to be told that if this leak called fistula happens, they may need another minor surgery after a gap of 6 to 9 months. Either way, all the stages, as I told, are ideally completed by 2.5 years, so that the baby can start play school like any other children. Now, after surgery, there are a couple of points. One or two tubes are kept to drain the urine to make sure that the tubes are not kinking, and we have to ensure that the free flow of urine. So what happens is typically these children go around the tube and then they keep on making a knot of the tube, and then that makes the child block the tube. So if that happens, then the urine starts leaking all around that dressing, and then the entire dressings become soaked, and then it becomes a nuisance. So we have to ensure that the tubes are smooth, not kinked or twisted. The baby can sit or walk after surgery, but keep the tubes below the level of the hip so that it keeps draining well. And also, one has to ensure that the baby passes motion comfortably. To make sure that the baby is not constipated, but because training for the stools can sometimes make the baby pass urine around the tube, and this can lead to dressing getting soaked. So it is best to avoid this, as it is not advisable to remove the dressing earlier than 7 days in most of the cases. One has to keep applying plasters if necessary. So I also advise the parents to put the triangle fold nappy to cover the area so that the baby's hand do not pull the tubes or dressing. So a lot of people are apprehensive about it, but I think having a nappy right from day one prevents the baby from pulling the tubes and dressings out. Now, babies often cry with the colic due to tube irritation. So this can be overcome by change of the position. If the baby is crying in a standing position, then make them baby lying, or if it is lying, then the baby can actually lie down on the side also, but not on the stomach. So sometimes older children complain of itching in the anus, and they often complain that there is a worm kind of irritation, but that is mainly due to the catheter in the bladder, and that often disappears after removal of the dressing. So we often give antispasmodic medications to stop these spasms happening. But until the tube is there, some amount of itching will be there. So we have to ensure that this is expected, and they are not worried too much about it. A small amount of blood in the urine is okay, so it is nothing to panic. That's mainly because there's a catheter in place, and once the catheter is out, that will be all right. After removal of the dressing, some amount of spraying of the urine and deviation of the stream to one side can happen. This is often due to the clots at the tip of the opening, and it often gets better over the time. So it is okay to have a spraying for some time, and it is very difficult to assess how the outcome is immediately after the surgery. I would suggest that during the immediate post-operative period, like 2 to 3 weeks also after removing the dressing, one has to be careful not to handle that area, not to rub the area too much, and then not to lie on the stomach, because it is still healing. After 3 to 4 weeks, the healing is complete. At the next follow-up after a month, the doctor would say how the healing is, and at this stage, extra care in handling and sleeping can be relaxed. So also at this stage, your doctor can tell based on the urine stream whether any more stages is required. For example, even in those who have planned one stage, because of a leak, sometimes a second stage may be required. This is quite a common thing, and it is because of many factors: the healing factors, the general nourishment, the child pulling the tubes, and some of the stitches breaking down. It is possible that a second stage may be needed, and that is quite expected, and there is nothing to be worried about, because after the second stage it will be completely all right. Now I also tell the parents about the dressings, what they look like. So this is one kind of dressing I put for these children, and this is the other kind of dressing I put for these children. So the parents have to be aware of how the things will look for a week. Okay, so these are the instructions I generally give for these parents, and I hope this video is useful for the parents. Thank you.